Okay, now after the athlete suffers the injury from either one of the two mechanisms, non-contact or contact, our differential diagnosis is going to lead us to test him out for the laxity of his ligaments in his knee. So we'll test out the ACL, PCL, LCL, MCL, but in terms of anterior drawer test, we're going to look for ACL integrity. So for testing of the ACL integrity, we're going to use the anterior drawer test. So we're going to have our patient lie supine. This way we get him to have complete relaxation. Okay. The anterior drawer test is going to test the ACL, and the ACL is what holds the tibia from translating anteriorly on the femur. So in order to have this test appropriately performed, I ask the athlete to move a little bit to the side of the table. Just slide over. Good. Okay. Now I'm going to ask that you stay completely relaxed. This way the hamstring tendons don't give me a false negative. I will stabilize. If you can move over a little bit to this side. So I'll stabilize his foot, tibia, femur, just like this. Put my fingers, two thumbs right above the joint line, and my two hands are going to go right below the tibia plateau is. So palpating here, he has relaxed tendons. What I'll do is now give a couple of quick jerks, trying to pull the tibia and the fibula forward, and if there's any gapping seen here, which we don't see here, there's any gapping which we call a sulcus sign, then that's going to indicate that there's laxity to the anterior cruciate ligament. So the anterior drawer test has 3 grades to it. If there's slight laxity to it, we call it a grade 1. A grade 2 is when there's a little bit more of a gap to it. And grade 3 is when we find that nothing is really holding it from me pulling it forward. That's a complete tear. And that's the anterior drawer test.